So welcome everyone to our training on supporting your patients. This is ways to help your patients feel heard and to encourage discussion. I wanted to mention in Zoom, if anyone needs captions, there is a setting at the bottom called Show Captions, and you can click on that and see our words across your page if you would need that. Okay, Jeremy is moving the slides for me. I think we're ready to move forward. So this is me. I'm the director of, actually my title's changed, of health literacy education here at Health Literacy Media. I believe most of your names are familiar to me, but we are a nonprofit out of St. Louis working with the Kansas City Health Department to deliver various health literacy trainings, all related to COVID and vaccine communication. We're also developing many different materials, written materials, as well as videos on different health literacy topics around getting vaccinated and COVID in general. So before we begin, this is a small group. Feel free to turn your camera on, unmute yourself, ask questions, use the chat. We will be sending you a post-workout workshop survey after this, and then also a summary in your email. So we're going to talk about 4 different skills today. We've covered this in one of our longer trainings, but we're bringing this to the provider audience for just a quick little snippet. So these are skills that come from the motivational interviewing technique. This is not motivational interviewing in and of itself, but these techniques are really great to use when you are trying to motivate someone. These skills are also great just in general in conversation and communication with clients, with patients, with anyone you work with. So these are really versatile, helpful skills to know. And Jeremy, you can go ahead and move to the next slide. So in motivational interviewing specifically, and like I said, we're not going to get too much into that piece, but you're looking for ambivalence. Whenever you're wanting to use a motivational technique, you're going to listen to hear if someone feels ambivalent about something. And this really applies well to COVID communication because there's a lot of ambivalence about, should I get the vaccine? Should I get the booster? Should I get on the airplane? Should my kids go back to school? Is it safe to do this or that? There's a lot of ambivalence around these decisions. And so Jeremy, you can click through. Yeah. So does someone have ambivalence about a certain behavior? What do they value? What are their values in life, but also around this topic? And then is there a discrepancy between their behavior and their value? And if there is, that is a space where you can enter to try to help motivate them towards the right decision for themselves. So that's a little complicated, but I just wanted to set up the motivational piece for you before we move into the 4 skills. But like I said, these 4 skills can be used in any situation. As I'm walking through the skills, be thinking about where communication breakdowns happen for you. Is it on certain topics? Are they hard to communicate about? Do you see certain patterns when communications do break down? And then what barriers do you have speaking with a certain community, a certain group of people on a certain topic? And just kind of have that in the back of your mind as we're walking through these steps. So the first tip is open-ended question. And if you can't tell, that little figure there is a boat with 4 oars. And these are called the oars because they spell out O-A-R-S. And we'll start with the O, open-ended questions. If you've attended any of our other trainings, you've likely heard us talk about these. So these are questions that cannot be answered with a yes or no. So how was your, let's see, did you go to your doctor appointment? Is a yes or no. Tell me about your doctor appointment is an open-ended statement, open-ended question. And that allows, it asks people to engage with you. It offers them an opportunity to actually speak and discuss. Okay, Jeremy, you can keep clicking. So instead of, do you want more information? You would say, what information can I share with you? Do you think, oh, do you think you could do more if you got vaccinated? Yes or no? Tell me about the things you'd be able to do if you were vaccinated. That's not a yes or no question. Someone then has to think through their answer and give you some ideas, some sentences, and that allows you to then, it gives you more information and places for you to enter into a conversation. So some other prompts to get to use open-ended questions or statements are, how can I help you with something? Help me understand. Where did you learn this? How would you like things to be different? Where could you go for support? What things would you look forward to? What do you want to do next? Tell me more about that. So these are all great ways to invite conversation and not shut down a conversation, which yes or no questions often do. So we're going to move. Oh, sorry, I forgot we have this little activity. So feel free to just think or write in the chat or say out loud which for each of these 5 statements, is it an open-ended or close-ended? So do you think you will change your mind about getting vaccinated? Open or close-ended?
Closed.
It is definitely closed. That's a yes or no. Mm-hmm. What concerns do you have about the vaccine for your kids?
Open.
Open. On a scale of 1 to 10, how important is that to you and why?
Open.
Open. And the why question is important there, because if you just said on a scale of 1 to 10, that could possibly be a closed question. Why do you believe that?
It's open.
Open. Do you believe the COVID-19 vaccine is safe for children?
Closed.
Yeah, closed, right. You get it. So this takes practice. It's easier said than done. So it's easy in a little quiz like this. In practice, I know that when I learned this skill, I was catching myself all the time. I just immediately would ask the close-ended question. So I've learned to stop before I ask a question and really make sure I'm framing it correctly and wording it correctly before I do it. And that's a skill and it takes practice. Okay, now we're going to move on to A, affirmations. These are just nice things to say, basically. You're listening to someone, you're really using active listening, you're listening deeply, and then you want to just reflect back to them, just something positive about them. So I appreciate you being willing to talk about this with me today. You're clearly a resourceful person. That's a great question. You can see how much you love your child. These are just these small positive affirmations you can say that really can change the tone of a conversation, especially if it's ever a stressful or a tense conversation. It can kind of de-escalate in a way. So affirmations. The next one is going to be an example of what this might look like in a conversation. So, no, I don't think I want my daughter to get vaccinated. I heard it means she can't have babies when she's older. So a kind of an easier affirmation would be, thanks for sharing your feelings on this. You could go a little deeper and you could say, I get it. I have a daughter too, and we worry about our children. So it's a different kind of affirmation. And then you could even go a little deeper. I can see you've been thinking a lot about this. So that's kind of an affirmation and a reflection, which we'll get to next. But basically you're trying to comment on this person's positive behaviors or positive thoughts, kind of picking out the little gems and kind of reflecting that back to them to make them feel good, to keep the conversation positive. So reflections and affirmations are kind of similar. The difference is reflections go a little bit deeper into emotion. So reflections are going to be, so you feel like this. So you're listening to someone and you're hearing their words, but you're really thinking about the feeling underneath them. It sounds like this. So you're wondering if I hear you saying this. So sometimes people say something, but their behavior or their emotions don't match. They're different. And so a reflection is a great way to comment on that. Say, I see you saying this, but you're looking down and you look sad. So tell me about that. You're reflecting on their emotion. So I believe we have some examples here. So you're worried most about your child's mental health. I hear you don't trust the FDA. So you're getting at that trust, you're getting at that worry. I get that you don't believe COVID is as scary as people say. You're getting at that belief. You have tears in your eyes. I can see that you're sad. You're getting at the feeling of sadness. I understand that you want to trust the vaccine, but another part of you feels hesitant. That must feel confusing. So getting at that feeling of hesitancy, ambivalence, confusion, and reflecting on that. And oftentimes people will say, yes, I am. And then you can say, well, tell me more about that. And you just kind of keep going deeper and deeper into the conversation surrounding their emotions, their feelings that are underlying their words. It's a really great tool and also takes practice. So no, I don't think I want my daughter to get vaccinated. I hear it means she can't have babies when she's older. So an easy reflection would be, you don't think you want the vaccine for your daughter. Okay, that's just really simple. You're not really getting deep into the feeling. You're getting kind of into the thoughts. A little bit deeper would be, so you're still thinking through the risks and benefits. You're really worried about what you've heard, but you could still protect her. It could still protect her. So you're kind of getting at that ambivalence there again, kind of pointing that out to them, that there's some conflicted feelings. So it sounds like you're really worried about your child's health. That tells me how much you care about her. So getting at that care, that worry. So really focusing there on the emotions, the feelings, and that allows people to feel heard and then tell you more about that feeling.
Meg, could I ask a quick question?
Yeah, of course.
So if you're in a real conversation, for example, at this point, might you tell them a little bit more about why it's safe?
So that's a great idea. And I would say that before you give information, it's always important to recognize the feeling if you can tell someone is having a certain feeling. So reflecting on the feeling is a great way to set the stage for the information that you might give. So you might say, it sounds like you're conflicted. I hear you saying this and I hear you saying that. Can I tell you a little bit more about the vaccine? Would it be okay if I shared what I know about the vaccine or what doctors say about the vaccine? And
Oh,
then,
okay, that sounds good.
yeah, and then asking, how do you feel about that? Is that okay? And then usually people will say yes. Sometimes they'll say no. But that's a way to invite them into the conversation and then move into the information, especially around vaccines, and different health issues around people's bodies. They can get very defensive, and often if we just give people information, it goes one in your ear and out the other if they're not really willing and asking for it. So the best way to set the stage is starting with that reflection on the feeling, the confusion, the ambivalence, and then introducing the idea of information. That's a great question, Connie. Thanks for asking that. And I know we're at time, so I'm going to fly through these last few slides. Summary statements is the S in the ORS acronym. And basically, you're just summarizing what you talked about at the end. So here's what we covered. Let's switch to a different topic, or here's what I've heard you say. Is that correct? And then you let people tell you yes or no. Did I miss anything? Tell me if I've missed anything. Do you want to add anything? That's also a great way to invite people to talk with you more. And I think we have some summaries here. So we have a couple different examples. So I'm hearing you're confused. Is there anything you want to add? So you're kind of reflecting on that feeling. And then, yes, that's right. That's what I've read about. And then you can go on from there. So here are a couple of resources to help you. And when we send out a summary sheet, we will include these resources on the ORS skills. And their last one is a little bit more about motivational interviewing for providers. So we are 1 minute over. Thank you all for joining today. On March 9th, we'll be talking about building your cultural and linguistic competency. Here is the survey in the chat for today's presentation, and we will send out the summary sheet. Thank you all for joining and hope you have a great rest of your day.